Hi everyone, I'm Anu Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, I thought we'd talk about what are things that I would want you to know as a patient. So here are the 5 things that your fertility doctor wants you to know when you're trying to get pregnant. Number 1, not getting wrapped up in certain ways to track ovulation that can be difficult. For example, cervical mucus or basal body temperature. What I would recommend are more objective ways to track ovulation. So the first important thing is knowing what regular cycles are. Regular cycles come every 21 to 35 days. If your cycles are falling outside this range, this would be considered irregular, and it would be reasonable to see a physician to get assistance, because ovulation could be occurring, but it could be more sporadic, or ovulation may not be occurring. The other thing you can try are ovulation predictor kits. These are looking for that LH surge that happens prior to ovulation. I would recommend name brand ovulation predictor kits and not generic. And the last thing you can consider is checking a progesterone level with your physician. So the timing of the progesterone level is very important. We want to check that progesterone in the mid-luteal phase. So that's when progesterone is at its highest. And this will be 7 days before you have your period. So for example, if you have a 28-day cycle, we would check it around cycle day 21. If you have a 35-day cycle, for example, we would check it around cycle day 28. So when we check the progesterone is going to be dependent on the patient's average cycle length. This leads me to number 2, knowing what your fertile window is. So I would recommend getting to know your cycles, and by getting to know them, I mean tracking them so that you understand what your cycle length is. And after you know that, then knowing when ovulation approximately will occur. So ovulation, generally speaking, is about 12 to 14 days prior to when you expect your next period. So for example, if your cycles are every 28 days, ovulation should occur approximately cycle day 14. If your cycles are every 35 days, then ovulation should occur approximately cycle day 21. So when ovulation occurs is, generally speaking, cycle dependent. Now, knowing when the fertile window is. So that is the 6-day interval that precedes ovulation. So we want patients to be having intercourse ideally every other day during the fertile window leading up to ovulation. The reason is that sperm can live in the genital tract anywhere from 2 to 5 days. And after ovulation, the egg is only viable for a short period of time, only about 12 to 24 hours. So we want sperm in the genital tract ready and waiting when ovulation occurs. So hopefully that egg and sperm will meet. Number 3, making healthy lifestyle choices to optimize your chances of conceiving. So in terms of diet, we usually recommend the Mediterranean diet, lots of fruits and vegetables, healthy fats like avocado, olive oil. In terms of exercise, trying to maintain 4 to 5 times a week of good cardio for 30 minutes, intermittent weights, just overall doing what you can to try and stay healthy. And ideally, we want patients to have a healthy BMI, and a normal BMI is anywhere from 18.5 to 24.9. In addition, taking a prenatal vitamin with folic acid and DHA. If ovarian reserve is a concern, also adding CoQ10 and DHEA. Other things to consider are minimizing caffeine. And so by minimizing caffeine, we usually recommend less than 250 milligrams per day. And that's usually equivalent to 1 to 2 cups of normal coffee a day. And also avoiding smoking, alcohol, and drugs. Number 4, knowing what the recommendations are in terms of sex. So there have been no certain sexual positions that have been associated with increased pregnancy rates. Lying down afterwards does not necessarily increase pregnancy rates, and putting your legs up in the air after intercourse does not either. So knowing that there are no specific recommendations regarding these things and increasing the chances of pregnancy. The other thing to keep in mind are lubricants. There are certain lubricants you want to avoid when trying to conceive. For example, KY jelly, because there are anti-sperm factors there. Lubricants that are okay to use are hydroxyethyl cellulose-based products such as Pre-C. Other lubricants that are okay are mineral oil and canola oil. Number 5, knowing when to see a fertility specialist. If cycles are regular and you're under the age of 35, and if you've been unsuccessful after 1 year, it's recommended to see us. If you're between the ages of 35 and 39 and cycles are regular, and if you've been unsuccessful after 6 months, it's also recommended to see us. If you're over the age of 40, it's actually recommended to see us right away. Other circumstances where it's recommended to see us right away are if cycles are irregular or if there's a known infertility factor, for example, a known male factor or a known uterine or tubal factor. The reason why it's important to know when to see a fertility specialist is that we just don't want time to be wasted. With the passage of time, there is a decline in ovarian reserve, and there's also a decline in pregnancy rates and success rates. And we just want to do everything that we can do for you to help maximize your chances of success. Thank you so much for watching this video. If you found the video helpful, please give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.